two, one.
Hello there. Hello there. Hello, everybody who's watching us and who has signed in to Laja TV. Let me quickly change the settings here. And yes, welcome to the October 1st episode of Laja TV. And it gives me so much pleasure to see all of you join in, all of you tune in, all of you listen to us, or at least go back to the recordings, because each of these episodes have something really important to share. There's a lot of awareness that we bring about, and all of this is done so that we get to meet with and interact with people who are absolute gems in their industry, absolute gems in the work that they do. And it's not every day that we get to meet these people on a face to face basis. So, Vandana Joshil, I'm your host for this episode. I am the COO at Laja and the managing director at Laja TV. Laja, for those of you who do not know what we do, is a forum, actually India's first forum, that focuses on women's growth, learning, development, and self empowerment. The emphasis being on self empowerment because unless you want to do something for yourself, there's nothing much anybody can do for you. So, this is a forum. We do all of these learning and development through mentoring sessions, through vocational skills sessions, through audits, through learning meets, and a whole lot of other activities that we carry on throughout each month. We also have two amazing segments. One is this Laja TV, of course, and the Laja Talks, which happens once in 3 months and it happens in different cities. We just concluded one in Pune, and the next one is scheduled in Surat in December. And this Laja Talks is a platform that we give women to share their stories because each and every woman out there has an inspiring story to share. Because aren't we all achievers? So, yes. Now, let's come to the topic for today. Last month, as in September 10th specifically, was World Suicide Prevention Awareness Day. So, the whole of September, a lot of conversations happened on suicides, how to prevent it, why does it happen. And unfortunately, there were a lot of suicides too. So, apparently, the conversation is not enough, the discussions are not enough, and there is a lot more that we need to do to say before people bring a clear understanding of what goes through the mind of a person who's disturbed. So, World Suicide Prevention Day is observed to raise awareness, focus efforts on directing treatment to those who need it the most. And remember, those affected by the suicide. So, those who need the most are the people who are having thoughts of suicide, and those affected are the family. Can you imagine what goes through a person's mind if you lose a loved one to suicide? So, Laja is taking this conversation ahead, and today we're bringing you a panel with three subject matter experts who will share insights into an individual's mental framework prior and during suicidal thoughts. Let's try and make an effort to make a difference. So, I will quickly admit my speakers. Let me introduce Dr. Milan Balakrishnan as he joins us. Dr. Milan Balakrishnan is a licensed psychiatrist with 12 plus years of experience in diverse mental health settings. He specializes in mindfulness based therapies and is a clinical professor at the Messina Hospital. He is a respected researcher and educator and has published in peer reviewed journals and presented at conferences. He is the founder trustee of Bipolar India an ex-secretary of the Bombay Psychiatry Society and a member of the Indian Psychiatric Society. He's passionate about online psychiatry and mental health entrepreneurship. He's also a visiting consultant at the Bombay Hospital. Welcome, Dr. Milan Balakrishnan. Thank you so much for being here.
Thank you. Thank you for having me here.
Yes. Now let me introduce our next guest. The next guest is Jyoti Mehta. Welcome, Jyoti. She's the head of training and development at QPR Institute India and is a qualified counseling psychologist. She's a gold medalist and a former chartered psychologist recognized by the British Psychological Society UK. She has contributed to esteemed organizations including NHS London, Samaritans London, Fortis Healthcare, and Tata Institute of Social Sciences India. With a passion and experience of working in diverse setups such as schools, hospitals, prisons, aviation, and maritime industry for about a decade, her expertise extends in providing counseling support for individuals feeling suicidal thoughts in person, as well as through 24 by 7 helplines in India and London. Welcome, Jyoti.
Thank you, Anna, for such a warm welcome. Appreciate it.
Thank you. And last but not the least is our very own founder, Riddhi Doshi Patel. She's a child psychologist, a dance movement therapy practitioner, parenting counselor, and mental health practitioner. She's a certified child psychologist. She's into dance movement, CBT, REBT, play therapy. She's a 3-time TEDx speaker and is the advisor to 16 TED clubs across the country. Riddhi is an ardent professional who walks the alley of her mission to redefine parenting and facilitates positive transformation in that space. A well-known advocate for mental health awareness, she has touched more than 1.5 million lives through one-on-one counseling, parenting workshops, and mental health seminars. So welcome, Riddhi. Welcome to Laja TV.
Thank you so much, Anna. Thank you.
And I'm so glad that we were able to put this panel together because these are experts who have dealt with cases of suicide. They have counseled before, they have counseled after, as in after somebody has gone through the trauma, they have counseled the families. And it takes a lot out of them also when they do this. So first of all, let's applaud for them. And then quickly jump into the questions. So here I am applauding for you. Now let's quickly jump into the questions. The first one, the very first and important question. Why does somebody get inclined towards ending life? Who wants to take it? Dr. Milan, do you want to go first?
All right. So why do people want to commit or are prone to sort of harm through suicide? Then there are multiple factors that go into it, right? We look at uh, factors that primarily most uh, have a mental illness or disorder that they are dealing with. Most commonly depression, severe depression, anxiety, uh, other disorders like schizophrenia, bipolar disorder, ADHD, substance use, or a combination of these can put people at very high risk for self-harm in that sense. But along with this, we need to also look at genetic factors. So uh, high risk of families having suicides, and that's fairly common when we see someone who presents to us and we see a family history of suicide. Automatically our risk assessment shifts a bit to say that okay, this is someone who's potentially at much higher risk. Um, so genetic factors come into play. Of course, other social factors, family dynamics, issues with that, support systems or lack of it, all of this would make someone prone to self-harm and eventually suicide. So primarily when we look at, again, we also talk about other issues like financial factors, um, issues that social factors that may add to high risk. So combination of factors must always be looked into when we look at suicide.
Okay. Interesting. I never thought genetics would play a role in this. I mean, we have heard of stress, we have heard of trauma, we have heard of other things. Genetics was not something that I expected to hear in the answer. But yes, makes sense. Okay, so then Jyoti, is it preventable? Is suicide or suicidal thoughts, are they preventable? It sounds like a lame question, but it's a question.
No, right. Thank you, Anna, for asking that because I think it's a very important one. Yes, suicide is preventable. Yes, suicide is the most preventable form of death, right? So, which means that if we know what to pick, if we know how to pick up a warning sign, if we know how to intervene, or like Dr. Millen said, understand that there are, suicide is multifactorial, so a lot of factors play a role, and if we're able to assess the risk factors, also look at the protective factors, and then intervene to ask the question if they are feeling suicidal, and then help them to sort of seek help from mental health professionals. Definitely, suicide is preventable, and you don't have to be a mental health professional. All of us can do our parts to, sort of play our role to identify, spot the signs, and save a life.
Okay. So Riddhi, I'll bring this question to you because I have seen, when there are times when we set up a meeting and then Riddhi has to leave the meeting because she has to go for a case like this. So tell me, how does one pick up a sign? How do you know this person has such thoughts?
So when I usually in children, since I only work with children,
Yes.
usually it is seen that it is more of changes in their eating and sleeping habits, more or frequent or probably persuasive sadness is seen. Okay, they're either withdrawn from friends, family, their likings or the spots they used to visit often. They kind of withdraw themselves. They have extreme, or sometimes they have complaints about physical symptoms, you would say, and even due to emotions, you will say extreme fatigue or restlessness, or as Milind said rightly, anxiety as well in children. Also, in children, it's often said that, often seen that they are withdrawn or they decline in their schoolwork. They don't want to do it. They don't want to follow any schedules as such. And they often seen that they talk about, "Acha, isse to main mar jata to acha tha." And the death and dying and giving up and all those things are often seen in children. I have actually seen that in my practice.
It's very interesting because, see, as a grown up, when an adult says that, there is a finality to it, I will end my life and my problems end. But I don't know, how does a child come to think of such a solution? One of you, any one of you. Riddhi, yes, you're a child psychologist.
So in children, either it's extreme case of bullying also, I mean, it's probably because of that also, or um, they have seen family talking about it. So I had a client long back, if you remember, and the father had a habit of, "Isse mein mar jata to acha tha, abhi main kud jata hu." So when the family member, precisely parents, have been talking or using such language, is where the child starts thinking about it. Okay, or probably peer pressure. So heard from friends or watched some videos or played some games, online games, wherein they are bound to do or they are dared to do, is where they start thinking about all this.
It's a scary world we live in. Dr. Menon, what is the general age group? You're off late seeing a lot of, you're reading about a lot of suicide cases among children, but on an average, what is the age group that really comes up with thoughts like this?
There isn't a fixed age group, right? More importantly, like Riddhi was saying, we see all ends of the spectrum, from children having thoughts about suicide and including attempts and actual harm, to to the other end of the spectrum, which is sort of the geriatric population, 60s, 70s, also having the same kind of thoughts. So if we look at it from a clinical perspective, it's like uh, it's a very serious complication of a mental illness. So a severe depression, and so even a child can experience severe depression. There's not any protection which says that a child cannot, or a adult cannot, or a person in old age cannot have thoughts about suicide and self-harm. So we see the entire spectrum, but of course, what comes to us more often through the media is often young suicides, because those are
Yes.
the ones that disturb us more, or bring about this thought about pressure, education, all of these factors coming into the sort of mix. But this is a highly vulnerable group. The adolescents, the young adults, they are a very vulnerable group. So we look at them with a lot more care or worry.
Okay. So again, I think this is just a question that popped up in my mind. Is there are men more susceptible to this, or are women more prone to having suicidal thoughts, or is there what will happen if I go, who will look after my children, kind of a thought that comes into women? Jyoti, would you want to take this?
Sure, thank you for asking that. With regard to gender, yes, if you look at the NCRV report, it does say that men are likely more to die by suicide, while women make more attempts. You also bring very beautiful point about protective factors, wherein you probably will assume that a particular gender will have a stronger sense of duty of care, and duty of care can act as a beautiful protective factor. So, a gender, or for that matter, an individual who is thinking about मेरे जाने के बाद मेरे बच्चों का क्या होगा, या
Yes.
how, if I'm not around, what will how will my parents going to survive? And interestingly, for some of us it could also be pets. Like, I remember when I was in a helpline in London, an individual who had absolute no hope. There was a plan, they were thinking about dying, but the only thing that was keeping them alive was, if I died, then who will take care of my cats, right? So protective factors is a very beautiful aspect of suicide prevention, wherein there's so much that we can bring in and add to people's safety net to protect them. I hope that answers your question. Also, there are different communities. So, we talk about different at-risk population as well. So, say if it is a queer community, for instance, they're more likely to experience isolation or discrimination and so on and so forth. So, certain sects like that would, make someone more vulnerable. However, I do echo that this is not something that we think is happening to the others. With the alarming numbers that we see around, and so WHO says that 1 in 4 individual at some point in time will experience depression in some or the other intensity. 1 in 4 in India is almost every family. There's another
Yes.
study, by IASP, which is the International Association for Suicide Prevention, which says that when an individual is experiencing depression, they become 20 times more vulnerable to feeling suicidal. So 1 in 4, 1 in 4, 1 in 4, right? So at some point, we'll experience, and again, there's a whole range of, from suicidal ideation to having to plan, or attempting, and so on and so forth. So that varies. However, yes, it is something that we must talk for our own selves, for our loved ones, for our kids, for our elders, yeah, and for our
Absolutely.
bigger community.
Absolutely. The fact that now we are at least talking about this, whereas I think there was a generation where even an actual suicide would be brushed under the rug and people wouldn't talk about it. Suicidal thoughts were, of course, never ever given any importance. A tight slap would, the assumption was a tight slap would bring the person into, reality or reality check. But it's good that at least now conversations are happening about this. Now, the statistics are out there for us to see and to read and all of that. Let's talk about what is the kind of support that we can give. Is seeking medical help, going to a psychologist or a psychiatrist, the only kind of help? Or you spoke about telltale signs, all of you spoke about telltale signs. So what can an immediate family member do for somebody who's having suicidal thoughts? uh, any one of you can go, you're all experts.
Yeah. So I guess Dr. Balkrishnan and Jyoti would be the best to talk about adults. But for children,
Yes.
I've always told the parents that do not ignore when they talk about it. Do not say that it's temporary phase. If your child is constantly talking about death, life after death, what's going to happen next, how the world would be beautiful there, please don't ignore the signs and just be there. Try and understand the language that is not spoken. That's the non-verbal language. Okay. Try and understand the behavior. And each time you see unusual behavior, unusual talks, unusual, habits, visit a professional, a mental health professional, precisely a psychologist or a psychiatrist. I always say
Okay.
that instead of giving advices that, hey, that's nothing. I mean, ऐसा कुछ नहीं होता है. तुम ये सोच रहे हो. No creepy things or crap things to be spoken at that moment. The most important thing by the parents or a friend has to be like, I understand. It's acknowledging, immediate acknowledgement of the emotions, and then showing a path or deviating them to something temporary, or making them convince of, okay, let's go to somebody who can guide you better. Okay, these are the words to be spoken rather than any advices to be given to children. I'm specifically talking about children, and for me, children, anybody
Yes.
that falls below 18 years is a child for me. Okay, scientifically we use adults and teens, young adults, but for me they are children. So anybody below 18, if you are catering to, it's important that you're out the person. Okay, stopping the person is detrimental rather than not, just advising or doing anything else. Hearing out that person, making the person speak, probing small questions. Acha, aisa kyun? Probing helps to just vent out, and probably that can be, avoided, or that can be prolonged. Until then the person can get a professional help. But sunna bahut zaruri hota hai.
Yes, and when you're dealing with children, their emotions are also on a different level altogether. So maybe they're not as expressive as an adult, but maybe an adult doesn't talk about it because suicidal thoughts itself, uh, from my understanding as a layperson, stems from the fact of a failure in something, a failure in a relationship or a failure in whatever work or whatever. So, you're already going through that. Why would you want to talk about why I feel like this? What do you say, Dr. Milian? So the same question comes to you. Is going to a professional the immediate criteria, or can the family or friends help then and there?
No, so let's first look at it from a more sort of social point of view, right? That we look at,
Mm,
we're talking about this uh, high number that we're seeing. When we look at,
yes.
say, depression, anxiety, we're saying 20% of the population is suffering from it. They're prone to suicide. All the other illnesses also contribute to it. So we're looking at a large population that is vulnerable to suicide at any point of time. Uh, one unless everybody of us, and I'm talking about non-professionals, is
Mm,
trained to be able to pick up these
okay.
subtle signs, no help is ever going to sort of reach this person. So
Okay.
one, being able to pick up the signs, and two, knowing how to respond to the signs. What Riddhi explained beautifully was the need to not respond by giving advice or by just sort of saying that ये विचार आते हैं कोई फर्क नहीं पड़ता है, या or the myth that those who talk about it will not harm themselves.
Huh.
That
Yes,
is
that's a myth.
a myth that we must sort of reinforce, that people जो बोलते हैं वो नहीं करते. But at the same time, so being able to identify this group of people who are prone to it, vulnerable, withdrawn, all the things that we described, people who have moved away from people who start talking about death. And I think very it's fairly easier even on social media to see either a person who suddenly disappears from social media, a person who starts posting very philosophical poetry about death, about harm. A lot of this content you can see, and those are alarming signs. And these are subtle things that we can sort of pick up and be able to help someone quickly. So that's so whether on social media or or in person, when you see signs where a person is talking about harm, talking about giving things away, talking about मैं अपने फ्रेंड्स को बुला के मिलने की कोशिश कर रहा हूँ. I'm meeting friends suddenly. I'm giving away things to my friends. All these are very alarming signs, and these are things that so once you identify these signs, yes, about being able to say that not to advise, but to listen, to understand, to be able to sort of empathize with the person, no jumping to conclusions about why they're feeling this way, what is happening to them. And but when strong thoughts about suicide, self-harm are there, there is need to reach out to a mental health professional, because at the end of the day, we know that this comes from either a severe mental illness or something that is triggering off very high intensity of suicidal ideations. Again, like Jyoti was pointing out, there's this spectrum of suicidal uh, idea, from just thoughts to ideas to planning to actually executing. So to be able to pick up things early and intervene, I think that can change things for people in a large way. And again, suicide prevention cannot happen through a mental health professional, because unless uh, people have reached out, there's no way a mental health
Yes,
professional can
yes,
prevent suicide.
absolutely.
So most of the suicides happen to people who have never visited a mental health professional, because they've never had access to it, or it's been gone past that point where they could uh, nobody helped them reach out. But so the person supporting the person should make sure that they are available till help is available.
Huh, true. So, Jyoti, I'll take this question to you. What Dr. Balakrishnan said is that there will be telltale signs, but you often hear of, I mean, you hear of stories of people who say, "Oh, he was laughing till last night, and we spent so much time together. I never had a clue, and then suddenly this morning he's no more." So, is that also possible that you get no signs at all?
Sure. Thank you for bringing that up. I think just to add on to what Riddhi and Dr. Millen have been saying. So what you're talking about is when you talk about stages of suicide, we call it the autopilot mode, right? Wherein the individual has been thinking about suicide, has moved to planning. There was no intervention, has now also made a decision to attempt suicide, and because of the decision of attempting suicide, the decision which helps them understand that now they are going to end the pain that they are in for so long. You see a shift in the behavior in terms of normalcy, if I can say so, right? Like what you're saying, oh,
Okay.
everything was all right. So, like how the two of them have been, just to reiterate that any deviation in a behavior, somebody who's been constantly feeling low and suddenly wants to throw a party or wants to get together and say, okay, bye, or apologize for something that they've done, if there's a change, for that matter, even if they're in therapy, if there's a sudden change, it's a good idea to not assume that it's healing, but to just pick up, like identify that there's a shift and a change, and be mindful, and just sort of intervene to say, hey, I'm happy that there's a change. However, can you help me understand what am I missing? So why I say this is, also just to put out stats there, 8 out of 10 people who are thinking about suicide will give us warning signs. 8 out of 10,
Okay.
which means we have to learn how to pick. And I think what we do with, a gatekeeper training is, and I can't agree more with Dr. Millen saying, the accessibility of mental health professional in India is, I mean, you can't match with the, available mental health professionals. Not having, I mean, we will have to move to community-based interventions, and hence educating people around us or in the community or the stakeholders. Um, and one form is gatekeeper training, essentially, which helps everybody to just identify these warning signs and intervene and then refer out. So, like he was saying, that if nobody intervenes and pick up the warning signs, we'll probably never see them, right? So then it becomes important for the family member to be able to know what to pick. It's like similar to CPR, right? If someone has a cardiac arrest, if someone knows how to do CPR, someone able to sort of start giving CPR till the help is available. Now, there are two key factors. A, that I know how to spot a sign that someone is having a cardiac arrest. Two, that I know how to give CPR. And three, that I don't keep giving CPR and try to become a heart surgeon, but get them to an ambulance or a hospital. So I think it's same for suicide prevention, wherein even if you pick up a warning sign, don't just stop thinking that, because you've advised them or given a solution that you think is a solution, it's going to just work out magically for them. That's it. They're never going to, they're out of it. But, like we say, let the professionals do and do their bits, because there's a lot of training that goes behind, a lot of, understanding of what we can offer, a lot of evidence-based interventions that, come into play. So it's easy to say active listening, be there. So we also talk about, just because you pulled out about what others can do. Anybody who's feeling suicidal, we can look out for these four red flags. They're feeling helpless, saying nobody can help them. They're feeling hopeless. There's no end. There's no light at the end of the tunnel. There's no point. Even if you help me, it's not going to change. Worthless, feeling a sense of burden or failure, like you were saying, right? Or feeling trapped. They'll just say that I'm unable to sort of breathe, or it feels suffocated, for example. So any of these four things you pick is enough for you to, reach out to them, say that you care for them, listen to them, and then, support them as they seek help. Very similar to what we would do on a physical illness or a health issue, right? If there's
Yes.
a fracture, we wouldn't say, it's fine, just stay at home. Right? We would actually get them to an orthopedic. Very similar. Yeah.
Yeah. Interesting. Dr. Balakrishnan, what about an individual who has attempted suicide, but has failed? Uh, is the spiral downwards even faster? Or I don't even know if this is the right question to ask.
No, fair enough. I think what you're asking is what happens to a person who has attempted suicide and then then what's happening to him after that, or what's the thought process like?
Yes.
I think goes through a variety of emotions, from guilt to shame to being all the sort of images of what society would label the person as playing out for him or her. So one feeling like a failure, like talking in terms of I couldn't sort of succeed even in this. Uh, we've heard uh, sort of patients, clients talking about it in that fashion as well. For some also, it is a sense of relief that, oh, I feel sort of better. It's sort of a certain level of closure and a sort of an ability to review things. And also, when we look at the other aspect, right? When we talk about attempted self-harm and we talk about things as uh, society tends to label those as attention seeking behaviors. We would call them
Yes.
help seeking behaviors. We would say that this is not attention seeking. This is that they are seeking help at some level. They may not know how to seek that help. And then the self harm then eventually leads to access to the system, right? Because a lot of adolescents that we see
Yes.
with self-harm and relatively sort of non-threatening self-harm, non-lethal
Mm.
methods of self-harm. Um, but those are the vulnerable ones. These are the ones that we need to save so that they don't end up with uh, ending up in death. So those are your early signs. So you need to pick these people up and be able to help them so that that actually gives them access to the healthcare system. But what happens is sometimes in the healthcare system also these things get brushed under the carpet. Like to give just an example, I had this adolescent admitted with us for a serious self-harm attempt, and post her medical stabilization, we said that we need to keep her longer because we need to also work on this other aspect of it, right? Which is the cause for what happened, not the physical
Yes.
issue itself. So, but the parents were of the opinion that since she is now better and she doesn't want to stay in the hospital, we should take her back home, and tried to explain to the parent that that's not how it will work because she's still at high risk, and going back from a hospital, from sort of the security of a hospital in that sense, the risk is still higher. So I think those are the things that we need to be very aware of, and emotions that come through after an attempt could be very varied and through an
Very
entire
well.
spectrum.
It's interesting that you spoke about the parents also. I think Riddhi dropped off. But it's interesting that you spoke about parents also, because whatever goes, I mean, after such an incident, there's a lot that goes through the survivors, as in the family that is left behind, the loved ones that are left behind. Um, do they also seek help, or do they just, I mean, what is the norm really?
Let Jyoti take this, then I'll add something that if
Okay, Jyoti, over to you.
Thank you, Dr. Millen. Okay, so let's see about how people around them are feeling, right? So I think a very common feeling is feeling inadequate or feeling that, oh, they couldn't pick the sign, right? They are
Hmm.
they were incapable. It could also make them feel a lot of anger, saying, oh, maybe what I think is the cause of why they, so for example, they didn't score great, right? And then there's a lot of anger at the person or themselves. So it could be saying, oh, they couldn't even manage so much. It wasn't such a big thing. Or anger at their own self, saying, oh, what kind of a parent am I?
I made a big deal
So
out of it.
yeah, like I should have, been able to support, or angry at them that they should have spoken about this, right? And I think they could, however, losing someone to suicide, while, like any other grief and loss, brings a range of emotions, from denial to shock to, depression and all of that bits. I think there is an additional feeling of a constant guilt, saying that, I wish for one last time, maybe that time when they called me at night, I would have stayed longer. Or maybe I could have said
Yes.
something different that point in time. And not just family member, another research suggests that one loss to suicide impacts about 135 people in their community, right? Which makes their closed ones, their people at work or at their education system, their community, the neighborhood, and so on. So yes, when you said at the start that now we've at least started to talk, I think we're in the age and era that we don't have an option, because I
Yes.
think all of us are hitting that bit, and you know, it'll be you'll be on. I wish that doesn't happen, but you are more likely to be on either of the ends. Whoever is listening today to us, may have experienced it for themselves, or may have heard of someone, who may they have
Someone.
unfortunately, lost to suicide and so on and so forth. And I think
Scary.
it's painful, because unlike other deaths wherein people say, yeah, I mean, you've lost someone to an accident or to a terminal illness, there's a lot of empathy that comes in. But
Hmm.
when, unfortunately, there's a death due to suicide, I think a lot of families in India don't want to talk about the
Don't want to
reason,
talk about
because
it.
there's a lot of shame, blame, and all of that happens, which only
Yes.
makes it worse. Yeah.
True. Dr. Balakrishnan?
Like to just sort of add to that briefly, it's a like Jyoti was talking that the parents will struggle, a family will struggle and go through their own uh, emotions, including guilt, shame, shock, all of these experiences that they will go through, sort of, and retrospectively they will constantly process the thoughts about, uh, they will start seeing the signs which they did not see,
Did not see. Yes.
which they did not see before, but so now they'll start seeing those signs and start making sense of them. And I think that can increase the guilt, shame, all of that together, because you're now in a position you're saying, oh, I missed that one. And especially if they get into this trying to understand, reach out, and they'll go through all the processes uh, that grief, the grieving experiences, which will be amplified very intensely by these other emotions. So I think, and also, so a lot of people, of course, finally will process these emotions very differently. Either they'll go through a sort of settling down, getting to either getting busy in life or doing something that can take them away from these thoughts. Or a lot of people also use it, and I think that's something that we've seen also, that people use it as a way to sort of help others, reach out to others, and I think that's something that helps them, as well as then transcends into sort of sublimating all those emotions into something more powerful. So when you look at people who run organizations that work on suicide
Yes.
prevention, they're usually uh, those who have lost
Have lost
someone
someone.
to suicide. So I think that adds to the whole need of support systems, like Jyoti was talking about gatekeeper training, and ideally, the ideal scenario would be that each person,
Hmm.
uh, everybody goes through some sort of gatekeeper training. I don't know whether formalized gatekeeper training on such a large scale will ever be possible, but at least the awareness of what to pick up, how to respond, what not to
Yes.
do. Even these few things, if we can, through these conversations, generate and get to more and
Absolutely.
more people, I think that's something that we can really sort of get out there for
Absolutely.
people to pick up on.
Very true. Uh, See, conversations like these need a humongous amount of time, which we unfortunately do not have too much of. So I will quickly ask Jyoti to talk about what we should do or what we should look out for. And we can have Dr. Balakrishnan talk about what we shouldn't do. And with that, then we'll, try to somehow sum this up and come to a conclusion, so to say. So, Jyoti, what should we do, or what should we be looking out for?
Okay, that's an interesting one. And I love the do's. Okay. First thing, become aware what it is. Just like if someone in your family is diagnosed with diabetes and you're trying to support them, you would want to learn about what the thing is. So instead of saying, oh,
Absolutely.
instead of just saying, oh, this is just a feeling and it'll pass. No, learn more about it. So educate yourself would be my first do. Gatekeeper training would be my second one, because that really prepares you to. It's like how we talk about CPR. QPR is a emergency mental health intervention, so you know how to pitch in and support life. So whoever is listening today, you're a student, teacher, parent, lawyer, doctor, anybody, firefighter, anybody. I think all of us in our areas, from aviation, from maritime, shipping industry, anything, right? All of us can play a part. So do a basic training of knowing what to do during a crisis time, because a mental health professional may not be just around and available and accessible and affordable, maybe. So that's another do. What else to do? Please do a quick, if you can, gauge some risk factors. If there are any, if they're talking about suicidality, ask them, and if you pick some warning sign, ask them about a suicide question. No, you will not give them an idea. It'll only help them to talk about it. So yeah, that's a main myth out there. So please ask them if
Yes.
they're feeling suicidal. It's not it's about death and dying. If they're not feeling suicidal, they just say no. It will not
No,
suddenly be like,
yes.
oh, now I'm thinking. All right, we're talking about suicide. A lot of us are listening to it. We'll see the recording later. Are you all going to feel suicidal? No, right? So we talk about it, it only adds to awareness. So ask that question would be a do. Take them to a mental health professional would be a do. Um, what else is a do? Add more protective factors would be a do. So could be a life skill, could be some, ask them who is a trusted adult or a safe adult. Bring them. Don't have to do it alone. Mobilize support. Create that circle of
Hmm.
protection around them is a do. Break the confidentiality if they've said it to you. You have to, in the ways that the person is feeling comfortable.
Yes.
If they want to talk about it to their safe adult, let them, but please don't keep it within. So it's a do to not keep it confidential. Another major do is, if they are talking about suicidality, ask them if they have a plan. If they have a plan, please ask them if there is anything around them with which they can harm, because you want to remove the access to the lethal means. Research
Be that
suggests that,
direct.
yeah, please do, yeah, because they're thinking about it. You're probably the only person, maybe the last person they're going to talk about it. So it's like that heart attack moment. So you really want to intervene, and if that's okay, if you're feeling scared, not feeling okay, it's fine. Bring in other people. That's completely fine. So
Wow.
why I talk about access removal is important, because that is going to be, there's something called suicide crisis. Access to a lethal mean during that suicide crisis, which may range from a few minutes to a few hours, makes it more vulnerable and probable of a suicide death, which means that, if you sort of make sure you ask that question, would be a do, and remove that would be a do. And
Interesting.
just make them feel the opposite of helpless, hopeless, worthless. Just make them feel seen, heard, validated, non-judgmentally. Yeah, that would be a do.
Wow. Nice. That was well put. Uh,
Thank you.
Dr. Balakrishnan, what should you not do?
Not to. Mm. All right. I think what you should not do first, not invalidate this idea that about self-harm. Don't ever say ऐसा कुछ नहीं होगा,
Hmm.
सब ठीक हो जाता है. Don't say these things, because they are very invalidating, and they don't give the person an opportunity to talk about their suicidal thoughts ever again. So you miss a big chance if
Yes.
you invalidate their feelings. um So sort of getting them. So don't sort of go into an advice mode where you say, "Oh, ऐसा हो रहा है आपके साथ तो हम ये let's do this, let's do that, let's go out, let's drink." Typically the kind of things that friends would think would be helpful. Let's go have a drink today. Probably let's have a joint. It could be all things that could
Ah,
make the person actually more vulnerable.
more
Uh,
vulnerable. Absolutely.
because mental illness plus substance use plus suicidal ideation is potentially a lethal combination. So most suicides actually happen under intoxication
And the
because
influence.
the thoughts are there, and then when the inhibitions, the protective factors get taken away by the substance, that's when most suicides happen. So don't ever give these suggestions that uh, uh, don't don't talk about suicide as don't talk about being weak or being not capable of managing life, hence you're thinking about suicide. Don't ever add that element because it again just makes things more difficult.
Yes. The sense
So
of worthlessness kind of
just adds
just
to
goes
that,
up.
yeah. So
Yes.
don't ever do that. Right. And so just be supportive. All the things that Jyoti said really works, will help. And she did empower all individuals to sort of take more active role in
Yes.
intervention. So I think
Absolutely.
that would be very helpful.
This is great. Any helpline or any number that is easily accessible to people if they ever, if they are seeking help for self or for somebody in their family, is there any helpline that we can share? You can
Right.
give it to me later also if that's okay.
So there are effective helplines, including government helplines, the Telemanas, the Kiran helpline. So there's a lot of 24/7 multiple language helplines now available. Government run as well. Of course, we have the ones run by TIS, we have the ones run by ASRA. There's a bunch of suicide helplines that we can share.
Yes, that would be great if you could share with us in the comment section later, or if you could WhatsApp it to me now and I'll put it in the comment section, whichever ways. But yes, thank you so much. I know there are still a lot of questions buzzing in my head, but I had planned for a 30-minute thing, but we've gone up to an hour, so almost an hour. But thank you again so much. Thank you, Dr. Balakrishnan. Thank you, Jyoti, for taking time out. I'm sensing that Dr. Balakrishnan has a case to attend to right now, so I will not keep you. Thank you so much, both of you, for giving us your time and your expert advice. And I hope that we are able to bring about some amount of awareness. And Jyoti, you kept mentioning CPR. Unfortunately, even CPR is something that people don't learn. So being the gatekeeper is a big responsibility that people need to happily take up, I think.
Just to add a little bit, sorry, I'm interrupting you while you're wrapping up. So yeah, CPR, unfortunately, I learned it when I was working in a hospital. But so similarly, if you are in an environment wherein you are going to have people, because 1 in 4, remember? So people, so you have to,
Yes.
and I think with QPR, globally, we've done more than 6 million gatekeeper trainings. So yes, we are talking about it. There are a couple of we've been in IITs and we've done it with government of Andhra Pradesh and so on. We've done it in Kota. So yeah, I think look up.
Yes.
It's very accessible, and the one online which is self-paced takes less than 60 minutes to
Ah.
learn the skill.
So
So
yes, I'll try
it's
to do
something
a
that all
little
of us
research
can.
myself, or if you could send me the link, that would be great, and I'll share it. But
I'll be more than
yes,
happy to do
people,
that.
there are professionals out there who are trained and qualified to help you out. So please seek help when it's needed. Do not wait for the nth moment, because sometimes what we think we still have time is not enough. So seek help, reach out, and most importantly, open up and communicate. I think that is important. So thank you again, Dr. Balakrishnan. Thank you, Jyoti. You have been
Thank
wonderful,
you.
and
Thank you so much.
I learned a lot. So thank you again. You take care.
Thank you. Have a great rest of the evening.
Bye bye, Jyoti. Bye, Vanu.
Bye bye.
Bye
Take care.
bye.
And for all of you who are watching us, we'll be back next month with another special topic, another expert who will share information. And I hope, I do sincerely, seriously, dil se hope that you listen to this conversation and you share this conversation with others, because it is very important. Knowledge is useless if it is not shared. So please, please, please spread awareness. Do your bit and let's together make a difference. Thank you. Take care. Good night and see you all next month. Take care.